Here we'll talk about pathogenesis of alcoholic cirrhosis. We'll try to remember all the important points using this mnemonic free wholly. F here stands for fibrogenesis. It means fibrous formation or the collagen formation in the liver. What happens if we take ethanol? It will lead to destruction of hepatocytes, right? In case of damaged hepatocytes, this eto cells or the stellate cells will be getting converted into myofibroblast. These myofibroblasts will be synthesizing collagen in the liver, leading to the fibrogenesis of liver. So stellate cells get activated to myofibroblast in case of any damaged hepatocytes, leading to fibrogenesis. So that is F. Coming to R, so we have two R's here. So the first R stands for redox reaction. In case of ethanol consumption, there will be increased ratio of NADH, right? So this will lead to fatty liver, collagen formation, gluconeogenesis process is disturbed, and it can also lead to lactic acidosis and pseudo-gout conditions. So all this metabolism is getting disturbed because of NADH is increasing compared to NAD. So in case of redox ratio, there will be increase in NADH in case of ethanol consumption, leading to lactic acidosis, pseudo-gout, collagen formation, fatty liver, gluconeogenesis, right? Coming to the other R, we have retention of water and protein leading to hepatomegaly. So in case of ethanol consumption, there will be retention of water and also protein leading to hepatomegaly. Coming to E, again we have two E's here. One is the direct toxic effect of ethanol and the other is the direct toxic effects of the ethanol metabolites. Let us see the ethanol direct hepatotoxicity. If a person takes alcohol for 8 to 10 days continuously, it will lead to fatty liver. So this ethanol or the alcohol will be showing this toxic effects on this microtubules, mitochondria and the membranes of hepatocyte. Now coming to the ethanol metabolites, these also show this toxic effects on some products. Let us see what is it. So alcohol will be getting metabolized into acetaldehyde, which is the toxic metabolite. It forms addicts. So it forms two addicts. One is the protein addict and second is the MAA addict, right? This protein addict will be damaging cytoskeletal system and this MAA addict will be forming autoantibodies, right? And now coming to the wholly, H stands for hypoxia. It is because of the centrilobular zone hepatocellular necrosis. Why is this necrosis happening? Because of the direct toxic effects of ethanol and the ethanol metabolites. It will be showing toxic effects on this hepatic cells, which will lead to necrosis of this hepatic cells, right? In case of this hepatocellular necrosis, it will lead to hypoxia. And coming to O, oxidative stress. This ethanol is getting oxidized into many free radicals. These free radicals will be damaging membranes and proteins, right? And remember, this ethanol is getting oxidized into free radicals by this P450. Now coming to L, L is the liver fat deposition. So free fatty acids are accumulated in the liver, leading to hepatomegaly. We have also seen this water and protein retention leads to hepatomegaly. So here free fatty acids are also accumulating in the liver, leading to hepatomegaly. Coming to I, we have two I's again. One is inflammation, another is immunological mechanism. Coming to inflammation, when ethanol is consumed or ingested, it will damage the hepatocytes. We have seen how it will damage the hepatocytes. It will be having this direct toxic effects on the hepatocytes, right? So then it leads to release of cytokines, TNF alpha, interleukin 1, interleukin 6. So all this will lead to inflammatory reaction. And then later, it will cause hepatocellular necrosis and apoptosis, leading to hypoxia. Now coming to the last I, which is immunological mechanism. So if a person consumes alcohol, some may get cell-mediated immunity impaired, right? In some people, the cell-mediated immunity will get impaired. Even if they stop taking alcohol, their liver cells injury will be happening because of the cell-mediated immunity is impaired by the consumption of alcohol. So this is free wholly. So if we summarize, F is fibrogenesis. That means the stellate cells are getting converted into myofibroblasts, leading to the collagen synthesis. R is retention of water and protein, leading to hepatomegaly. And the other R is redox ratio. NADH is increasing, leading to disturbance in metabolism, and also it leads to pseudo-gout and lactic acidosis. Ethanol will be showing direct toxic effects on microtubules, mitochondria and membrane of this hepatic cells, right? Ethanol metabolites will be forming two addicts. One is protein addict and also MAA addict. Protein addict will be causing damage to cytoskeletal system and MAA addict will be causing autoantibodies formation, right? And coming to wholly, H is hypoxia. It is because of the hepatocellular necrosis. The O is oxidative stress. This ethanol will be getting oxidized into some free radicals which will be damaging membranes and proteins, right? It is oxidized by P450. And L stands for liver fat deposition, again leading to hepatomegaly. I stands for inflammation. And another I stands for immunological mechanism. So what do you mean by immunological mechanism? Cell mediated immunity is getting impaired. So even if they stop consuming alcohol, it will still damage the liver. Coming to inflammation, what is happening here? If you see properly, first there is ethanol consumption, and then it will lead to damage of hepatocytes. It can form adducts, or it can directly damage this microtubules, mitochondria, and membranes of hepatic cells, right? So when there is injury to this hepatocytes, there will be releasing of this cytokines, TNF alpha, interleukin 1, interleukin 6. It will lead to inflammatory reaction, so that is inflammation, and then later it will cause apoptosis, necrosis of hepatocytes, leading to hypoxia. So this is what happening if the alcohol is consumed. So this is about pathogenesis. Bye.